I think a community physician is somebody who has their own thoughts, ideas, and goals of how they want to practice in the community. But once out there, the community will make its needs known, and you'll adapt and adjust.
Dr. Kenny serves a multifaceted role in the community. In addition to working in the emergency room and providing direct patient care in that environment for decades, his role here in the clinic has been one of providing free care, but ongoing care to adult population. And in addition, the third role would be one of providing an environment in which we're teaching and preparing for caregivers of the future.
The people that walk in the door at that clinic are people who don't have a lot of other options, is the way I would describe them. In other words, the private office, you might see somebody for their hypertension. Well, I see somebody for their hypertension who just had a stroke, who needs a bus token, and who has no place to stay that night and is all out of their medicine. It's very, very common to see a diabetic patient, a COPD patient, a heart patient that has lost their private insurance and is on a list of medications as long as your arm.
He just dives right into a problem, and he always has a story to go with it and how they can relate to him through his different experiences with other patients.
I've probably seen 100,000 patients in my career, and each one of those patients probably had 2 or 3 loved ones associated with them.
Probably the most surprising thing that I've learned from him is his understanding of the social component of medicine, which is sometimes not outlined in school.
I learned a lot of things in school that from very erudite and august experts here. And then I'd go out in the community and there'd be some of that stuff I learned about, but there'd be other stuff as well, and stuff that I didn't know as much about. It's my good fortune to get educated here at Indiana. And I got an education in the facts of medicine, but also the process of medicine in terms of keeping up and professional bearing and professional responsibilities. I would advise somebody going into medicine to, first of all, be grateful. You're part of thousands of years of tradition. You're going to work in a fabulous profession that you get the ability to help people. You have professional respect. You will be able to take care of your family and be secure financially. And that's something to be grateful for. Obviously, you put a lot of work into it, but so did all the people who helped you and developed your profession down through the years. I think of it as a peer award, so I take a certain amount of pride in it that the people who nominated me and selected me have practiced out in the community and dealt with all the challenges of that as well. So I feel a certain sense of humility, but then likewise I take some pride in it.